Hello and welcome to the COVID-19 training protocols for the resumption of academic delivery fall 2021. In this presentation, we will talk about COVID-19, vaccination requirements, on-campus mitigation, and your social responsibility as it applies to COVID-19. During this training, we will cover off on what COVID-19 is, the minimum mitigation used at Canadore College, the guidelines for safe entry, and additional resources. We will review behaviors that are expected by all who enter the campus, including students and employees. Health and safety training is truly important. It provides everybody with the same foundation and knowledge that is required to be safe while on campus. We have guidelines available for each department, and those will be shared individually as you enter each class or lab. We will also review, as part of this presentation, the basic concepts of transmissibility, symptoms and signs of the illness, and discuss the minimum mitigation required for everybody on campus. Although there might be some mitigation that is employed by everyone on campus, there are still some additional training requirements for when you enter your class or lab space. During this section, we'll talk about what COVID-19 is, why the symptoms are so important, and how the disease is transmissible between one person to another. We will focus on individual behavior and the importance of employing the correct behavior to reduce the likelihood and mitigate the chance of transmissibility. COVID-19 is an illness caused by a novel coronavirus discovered back in December 2019. Coronaviruses are not new. They are a large family of viruses that cause illnesses such as the common cold, bronchitis, pneumonia, or you may have heard this term before, SARS, Severe Acute Respiratory Syndrome. The symptoms from COVID-19 are probably not unlike the ones that you've experienced in the past with a common cold or flu. With COVID-19, they could be mild symptoms or more severe, and the most common symptoms include cough, difficulty breathing, and fever. Those are the ones that are most known to individuals who become symptomatic. There are other less common symptoms, and if you have at least two of these, sore throat, fatigue, difficulty swallowing, loss of taste or smell, muscle aches, digestive issues like nausea, vomiting, diarrhea, stomach pain, headache, runny nose, pink eye, or falling down often, it may be because you are infected with COVID-19. There is an incubation period of COVID-19. An incubation period is the time between catching or being exposed to the virus and beginning to have signs or symptoms of the disease. The World Health Organization estimates that the incubation period for COVID-19 can range from anywhere between 1 and 14 days, with 5 days being the most common. The person infected with COVID-19 can transmit it to others without knowing it for up to 14 days. So that's becoming asymptomatic or pre-symptomatic, a person who is not aware that they have the virus or have signs and symptoms of the virus, but are still contagious and transmitting the disease to other people. There are a large number of asymptomatic cases of COVID-19. Estimates suggest that about 80% of the people with COVID-19 have either mild or asymptomatic or no symptoms of the disease, and yet they can still transfer or transmit the disease to other people during that period. Coronavirus is unique because of the way it is spread between person and person. This usually happens during close contact when physical distancing of 6 feet is not maintained. This happens when small droplets are produced by either coughing, sneezing, or even talking. The droplets usually fall to the ground or onto surfaces rather than traveling through the air over long distances. Less commonly, people may become infected by touching a contaminated surface and then touching their face. It is most contagious during the first 3 days after the onset of symptoms, although spread is possible before the symptoms appear. As we talked about earlier, a person may be asymptomatic, not showing any symptoms, and still be contagious, which is the reason why the mask wearing is so important. When it comes to COVID-19 preventative measures, nothing is more important than vaccination. Everyone entering the campus must be vaccinated with a single dose prior to September 7th, 2021, and a second dose no later than October 15, 2021. Those with exemptions will be permitted with an accommodation. Physical distancing, masking, good hand hygiene, and sanitization are all preventative measures that will be adopted during the fall semester in addition to vaccination. Self-isolation and daily self-assessment will be required to identify if illnesses are present for individuals that wish to enter the campus. Do not attend campus if you are ill, even with minor symptoms. Please report that to your academic lead or supervisor. Current measures at Canadore College includes department-specific protocols that outline the minimum mitigation required for each area. Currently, all campus locations remain in restricted access, which means only authorized people may enter through a designated entry point. Screening and self-assessment has to be completed on a daily basis using the Canadore Safe app. Please download the Canadore Safe app and conduct daily self-assessments prior to coming to campus. Promotion of hand and respiratory hygiene with increased amounts of hand sanitizer locations installed throughout the building, including in every class and lab. Enhanced cleaning throughout the building, including high-touch surfaces, as well as this health and safety training, which is required for everybody to take. There are many new terms when it comes to COVID-19, including physical distancing, which means to stay 6 feet apart or 2 meters away from the person next to you. Another important term for Canadore College is social responsibility. And really the focus is about us and how it applies to all the measures outlined in this presentation and what we need to do while on campus, including conducting a self-assessment on a daily basis, remaining physically distant by staying 6 feet or 2 meters apart from the person next to you, increasing our hand hygiene, and wearing our Canadore supplied non-medical mask or facial covering. You can bring your own facial covering as long as it's not distracting. Stay home if you're ill and wash your hands on a regular basis. Please watch the video contained on the slide by pressing play. As discussed, every area has a department-specific protocol in relation to the minimum mitigation outlined in this presentation, which includes requirements for daily self-assessment and screening, increased hand hygiene, limitation of movement, cleaning products available in that area for tools and work areas, and training as part of every plan. Some departments have increased requirements, including the use of additional PPE, department-specific barriers or flow patterns within the area. Please follow the department-specific protocol and the requirements listed in every plan. Restricted access will remain in effect throughout the fall 2021 semester. In order to obtain access to the campus, you must complete the vaccine passport attestation prior to entry. In addition to the attestation, we will provide additional instructions by the end of October for proof to be provided either via the Canadore Safe app or another method. On a daily basis, it is required that everyone complete their daily self-assessment to ensure that nobody entering the campus has signs or symptoms of COVID-19. If you have been in close contact with somebody who has COVID-19, please report that to your academic lead or to your supervisor, and additional instructions will be provided. Upon arrival on campus, proceed to the entry location as described on the slide. If there is a lineup, wait patiently in line and maintain 6 feet physical distance between you and the person in front of you. Upon entry, use a hand sanitizer station located in the front lobby and confirm your identity with security at the door. Security may ask to see your student ID or your driver's license. Security may also provide some further instruction and confirm that you have completed your self-assessment. As mentioned, vaccination is the most effective way to protect ourselves and families and our college community against COVID-19. Health Canada has approved vaccines that are safe and effective, including two types mRNA, which includes Moderna and Pfizer, as well as a viral vector, which is the AstraZeneca. Each one of these are approved vaccines for Canadore College. You must have at least one dose of these vaccines prior to September 7th and a second dose prior to October 15th. Vaccines do not give you COVID-19. You will not test positive if you receive a vaccine. To access more information on vaccine safety, please refer to the links on the Canadore Safe app, which will direct you to Health Canada. When it comes to COVID-19 vaccines, there is much misinformation about the safety and efficacy of the available vaccines. Health Canada has provided proven and safe, effective, high-quality vaccines, which have been tested through clinical trials. For more information on vaccine safety, please refer to the Canadore Safe app, which will refer you back to Health Canada on how the vaccines were approved, tested, and trialed. Based on recommendations from the Chief Medical Officer of Health, Canadore College has implemented a mandated vaccine requirement. You will not be permitted to gain access to the campus unless you have at least one dose of the vaccine prior to September 7th. You will also remain at risk of serious illness from COVID-19, including death, if you remain unvaccinated. It is also becoming more recognized that many people who have had COVID-19 have at least one persistent symptom 6 months after the infection. Even previously infected persons are recommended to get the vaccine, and it will be required for entry into Canadore College. Canadore College has implemented updated environmental cleaning services as dictated by public health in relation to COVID-19. This includes updated cleaning on high-touch surfaces and common areas throughout the buildings. Although Canadore College has implemented new measures as dictated by public health cleaning protocols to ensure that the campus remains safe, it is a shared responsibility to include increased sanitization and cleaning of workstations and equipment in between use. Please follow the protocols developed for your department and use only those products designated as approved by Health Canada, which are supplied from each department. One of the most important things that you could do to protect yourself and others from COVID-19 is to increase your hand hygiene. Canadore College has installed additional hand sanitizer stations throughout the building, including in every lab and classroom. It is an expectation that you clean your hands before and after using tools within the shops. It is also an expectation that you sanitize your hands upon entry into the building and before departing for the day. Although it may seem simple and a common task to wash your hands, there are certain techniques that public health has issued in relation to ensuring proper hand washing techniques. Follow the instructions on the poster on the next slide. Wearing gloves is typically suited to healthcare applications and not required when entering Canadore College or as protection against COVID-19. Hand sanitization actually decreases if you are wearing gloves. Use the hand sanitizer stations, wash your hands on a regular basis, and follow the directions by public health to increase your hand hygiene. Physical distancing is an important measure employed by Canadore College to ensure everybody's safety while on campus. Please maintain 6 foot 2 meter distance between you and other people. Another important aspect is the use of a facial covering to ensure safety while on campus. It is an expectation that the facial covering provided to you be worn while on campus, especially in common areas, while walking through the campus. The facial covering is a mandatory aspect while in labs and shops as well. This will be enforced by Canadore College. There are additional measures in some programs to not only wear a facial covering, but to replace that facial covering with a procedure mask and face shield while working in close proximity to other people within nursing, dental, PSW, or occupational therapy. Facial coverings, or non-medical masks, do have limitations and must be used safely and correctly. They need to cover your nose and your mouth. They are recommended in settings where physical distancing cannot be maintained on a consistent basis. At Canadore College, they will be used in addition to, not instead of, physical distancing. Both are required. They do not protect you, the wearer, from contracting COVID-19. This is part of our social responsibility to wear a mask in case we are unknowingly infected by COVID-19, as we don't want to spread the virus while on campus. There are proper techniques for wearing a non-medical mask or facial covering. Those two terms mean the same thing, and Canadore College will supply you with a non-medical facial covering to wear while on campus. Always clean or sanitize your hands prior to wearing your mask. Make sure that it fits properly over both ears. Avoid touching your face or mask while wearing it. Clean your hands immediately after. Wear it as long as it is comfortable. Take breaks. You are allowed to remove your mask while outside or in personal space like an office that belongs to you. Never share your mask with others. On the next slide, please watch the video on how to wear a mask properly and how to take care of your mask. As outlined in the video, there are certain techniques to make sure that your non-medical facial covering is used properly. Please maintain your mask and clean it on a regular basis. It can be put directly into the washing machine and dryer. Wash with other items using a hot cycle with laundry detergent and dry thoroughly. Regular washing of your mask is required. Always remember to sneeze or cough into your elbow, and yes, you can cough or sneeze into your facial covering as well. If you use your hands with a tissue or to cover your face, always sanitize your hands after coughing or sneezing. Never cough or sneeze towards somebody else near you. There are other important items we have yet to discuss. The Campus Health Center, located at 100 College Drive, is available and open by appointment only. Updates and scheduled times will be posted on the Canadore webpage. Drinking fountains are available and will be operational. We ask that you use the filling feature and avoid drinking directly from the unit itself. Cafeterias will be open at all North Bay campus locations, and posted hours will be available in the cafeteria for service hours. Please wash your hands before and after you touch common surface areas and before you eat in the cafeteria. Washrooms are open and will be cleaned on a regular frequency. In hallways, please stay to the right and allow for distancing when passing someone in the hallway. Do not stand in groups and block hallway or aisleways. Updated communication will be posted to the Canadore College COVID-19 dedicated webpage, which can also be accessed via the Canadore Safe app. If you have any concerns or questions, speak to your faculty member or program coordinator. If you see or witness something that is not acceptable, you can also contact security. Visit the website on a regular basis to update yourself on the latest communication. Posters will be placed at all entrances to remind you of the minimum mitigation we discussed in this presentation. As part of your daily self-assessment, reporting is an important aspect. If you become ill and are unable to attend the campus, you must notify your academic lead or supervisor immediately. Employees can use the reporting form and also inform health and safety and ODTM immediately. If you are unwell after attending campus, you must also inform your supervisor or academic lead. You may also contact security, who will find an appropriate room for isolation purposes if you are on campus. Safe transport will be provided. Sanitization of the area and the individuals will be employed afterwards. If you are unwell after leaving campus, reporting is also required. Please contact, again, your academic lead or supervisor immediately. Your mental health is very important in Canadore College. There are many services available to you as a student. You can contact Student Services, who continue to provide support virtually or on campus during the pilot period in August during the resumption of academic learning on campus. Remember to take breaks, go for walks, enjoy your day. This is an opportunity for us to get back to our regular routine while employing some additional measures to reduce the spread of COVID-19. Always maintain a clean campus. Never dispose of your disposable mask onto the ground. Use the garbage bins provided. If you are a smoker, use the designated new COVID-19 smoking areas and dispose of your cigarette butt into the appropriate container. Do not leave cigarette butts or litter on the ground. Thank you for listening to the presentation, and thank you in advance for implementing the measures as outlined. If you have any questions, refer to the dedicated COVID-19 webpage, talk to your academic lead or supervisor, and contact security if required. And most importantly, welcome back.